Another big story tonight, the distribution of the Pfizer vaccine in Oregon and across America. We start here in Oregon, where today Governor Kate Brown laid out where rollout plans stands so far. Fox 12's Sarah Hurwitz takes us through those plans and shows us how the virus has impacted one woman's life in heartbreaking ways. Sarah?
Oh yeah, today the governor said that the state is expecting to get 147,000 doses of the vaccine by the end of the month. This is a crucial step in an incredibly tough year, like the woman that you're about to hear from, who is already still dealing with symptoms from the virus. Dara Isaacson says on her 40th birthday, she got COVID-19.
And unfortunately was unable to celebrate or enjoy my mom's cheesecake she had made for me because I was in bed with racking cough, terrible body aches, unrelenting headache, 102.7 fever, and extreme fatigue.
That was in March. Isaacson says now in December, she is still struggling with symptoms from the virus.
I'm a COVID long hauler, and there are thousands of us across the country dealing with debilitating, long-term, chronic, possibly lifelong symptoms. I can barely walk around the block now, 10 months after my initial infection.
Isaacson says she was healthy and active before she got COVID-19, and now her life has changed. She's an example of the thousands battling the virus as the state prepares to receive its first vaccines next week.
As we wait for wide distribution of vaccines, one of our most important challenges is to remind Oregonians to keep up your guard. We need you all to keep wearing masks, limiting get-togethers, and maintaining social distance until we achieve community immunity.
The Oregon Health Authority says the state will need to vaccinate 70% of the population in order to achieve community immunity. In a press conference Friday, Governor Kate Brown said staff at hospitals and other inpatient facilities who have direct patient contact, especially with COVID-19 patients, will be prioritized first. Brown says it also includes workers in vital roles like housekeeping and food services. The governor says then the state will expand immunizations to outpatient facilities, including behavioral health programs and facilities for intellectual and developmental disabilities. And by the end of December, Governor Brown says Oregon expects to receive 147,000 doses of the Pfizer and Moderna vaccines. She says hospitals will be the primary sites for immunizations of the first group of vaccine recipients.
We think this step will also help slow community spread, especially among communities of color who comprise a disproportionate share of the workforce among non-medical staff in hospitals and at our nursing homes.
Brown says the state estimates about 100,000 Oregonians will receive vaccine doses by the end of the year. She says the state will be launching an outreach effort to build trust and confidence in the vaccines, especially among communities of color and other vaccine-hesitant communities. And at this point, the Oregon Health Authority says it has no distribution schedule for additional vaccine shipments from the federal government. Reporting live here in Southeast Portland, Sarah Hurwitz, Fox 12 Oregon.